Hi, Tim Russell here for Inovera Bioscience and Forvia Vitamins. Clinical Gastroenterology and Hepatology is a medical journal and reports results of research and clinical studies. Meant for physicians, the articles can be pretty arcane and technical, but some have information that's potentially useful to doctors and patients. In a recent issue, Dr. Papamichael et al. Reported a comparison of two approaches to monitoring Infliximab or Remicade in blood levels. The study compared two approaches to monitoring blood levels. Approach number one, called reactive monitoring in the report, the blood levels were measured after patients stopped responding. That is, a relapse occurred. Approach number two was titrating to a target blood level during the study, and that was termed proactive monitoring. The conclusions of the authors were that proactive monitoring, that is, the patients who received proactive monitoring, had better clinical outcomes as measured by less need for surgery or hospitalization and lower incidence of antibodies to infliximab infusions. The values for the measurements were statistically significant. In fact, they were quite significant. The study results and the authors argued pretty strongly for proactive monitoring. On the other hand, the target was a retrospective study, whereas the design of assigning participants at random to proactive or reactive monitoring would have been preferred. That's because there could be an influence on the results, because the people who had relapses may have been less responsive to infliximab in the first place. Arguing for the study results is another earlier study of infliximab among children that showed blood levels at week 14 of a 54-week study period predicted remission at week 54. And that would indicate the importance of maintaining blood levels. So both studies were based on just infliximab, so it's possible that other TNF-alpha blockers might not have the same results. Bottom line, it's interesting, potentially useful in managing infliximab infusions in practice. May need further study. I'll keep you posted as more results come out. Thanks very much for listening.